Hi everyone, welcome to this video. So excited because we're going to talk about Theraplay, and I've got Karen Doyle Buckwalter here with me, who's going to share some really good info and help us understand Theraplay better. Thank you, Karen, for joining me today.
Yes, thank you for the invitation. I'm thrilled to be here.
So I know that you're a registered play therapist supervisor. You do play therapy, obviously. You do a lot of Theraplay.
Yeah.
So people watching this video, I mean, maybe some of them never even heard of Theraplay before. They're not sure what this is an interesting word. So can you just start off by giving us some info on, what is Theraplay?
Yes. So Theraplay is a form of play therapy. And so that's the first thing for people to understand because a lot of people think, oh, you meant to say play therapy or something like that, or oh, it's the
Right.
same thing. Maybe a person thinks a parent maybe who's not as familiar with our terminology thinks Theraplay, that's play therapy. Like to them, like it's all the same. So it's a form of play therapy, but it has some very distinct characteristics that are quite different
Mhm.
than other kinds of play therapy.
Okay.
It's based on attachment theory and has evolved like many clinical models as we learn more about interpersonal neurobiology and neuroscience. And so, a couple quick ways that it's different. It's very physically active.
Mhm.
So we're moving around, like physically moving around in Theraplay. So that's somewhat different. Not that nobody moves in traditional play therapy, but not to this degree generally.
Right.
Another way that it is set apart, I think, is our use of leadership and structure. So in Theraplay, we're very clear the therapist is in charge of the session, is how we say it. And we have a planned list of Theraplay activities that we're going to engage in based on the children's needs. And so that would be quite different than perhaps child-centered play therapy. Now, I do want to say we will adapt that prescription, so to speak, for the session based on the children's needs. So I do want to be clear about that. Like that could
Sure.
change based on the response that we're getting from the children. But we do go in there with an idea of these activities that we want to do. The third way I would say is parents are very involved to the point that every fourth Theraplay session is a parent only session. And the parents are present in all the child therapy sessions. So again, we see a significant difference in, how some listeners might think of play therapy, like you don't have the parent in there with you every session. So that's different. Another thing that I believe sets Theraplay apart is our use of video and our assessment tool called the Marshak interaction method, where we videotape the parent and child going through a series of play tasks together, and then give parent feedback on what we're seeing in that video later. And then we use video throughout the course of treatment. So we are videotaping all the Theraplay sessions. And in that fourth parent only session, we're often sharing video from the treatment session with the parent. So I think some of those things are um, ideas and ways that we practice that are quite different than some of the other play therapy models out there.
Yeah, I think that really just full on parent involvement is so interesting and so good. I mean, I love that about Theraplay. It's not the parents just coming in and doing a consultation or the
Mm-hmm.
therapist giving them some psycho ed or whatever. It's really they are in participating in this therapy, equally with the child, and what's going on between that parent and that child and that family system is obviously given so much importance in Theraplay.
Yeah. And Robert, one of the things that I teach is when I'm teaching Theraplay or other workshops that I do, if you are based in attachment theory, your client is the relationship. So your client's not the child, it's not the parent, it's the relationship of how they come together. If you're working from an attachment-based model, you need, because how that child intersects with that particular parent is really what we need to be looking at and thinking about, rather than working separately with the child and not really seeing that interaction. So we start from the very beginning with that assessment that I told you, the Marshak interaction method, with I am looking, how does this dyad come together? What do they create together? What does the parent do? What does the child do in response? When the child responds that way, what does the parent do? And I'm looking at that interaction and wondering how I can help, ultimately through therapy, help that interaction to go in a better way than perhaps it's going when they first come to see me.
Yeah, I love that piece too. Many years ago, I don't even know if it works this way now. I did just a training on the mem, and it was so good and so neat. I just loved implementing it with that parent and child early on, first session, just part of gathering information about what's going on here, what's going on with this relationship. And it's really good. Like, it really shows you a lot of things.
It does.
Yeah, it really does. And I love that too, that, you're starting off from this place of, we're really trying to learn about this and gather information here to then form, what are the needs here and how we're going to move forward with
Yes.
family.
Yes. Yeah. And a thing that I think, as I was watching your expression when you said it, really shows you.
It
I
does.
think part of what that is the video shows us what nobody was able to tell us.
Mhm. Yeah.
The video shows the unconscious as well as the conscious parts of the interaction. And what do I mean by that? Not that you can see into somebody's brain, but there are things going on in the parent-child relationship that the parent's unaware of. And so it's not that they're not telling you because they're trying to hide something from you.
Mhm.
They are unaware that it's even happening. Now, I mean, occasionally, maybe there's things that the parent doesn't tell you, often related to shame about, something that's happening between them and their child. But basically, the Marshak interaction method is your window into the story neither the parent and child can tell you.
Right. Yeah. I love the way you described that. It's so perfect. And something else you mentioned when you said there's a lot of movement, in Theraplay, that movement is, usually play. It's like play between the parent and the child, possibly the therapist as well, but
Yes.
it's all kinds of different activities, games, play,
Yes.
movement, interaction.
Mm-hmm.
Right? And so when you were mentioning that, I just kind of wanted to bring that in, that it's like
Yes.
movement is play focused usually.
Yes, yes. So this is such an important thing to talk about, and also relates to, some of those early ideas. How is this kind of different than other forms of play therapy? We don't use props and toys the way they are used in traditional play therapy, such as, doll houses, puppets, art supplies, many of these things, because we engage in dyadic play so we might do a hand clapping game with a child. We might hold their hands, the child sitting across from me, and doing row, row, row your boat, where we're moving back and forth. We want an intersubjective experience going on between ourselves and the child, and we're eventually going to transfer that over between the parents and the child. So in that intersubjective experience, it's a shared affect going back and forth. Where in Theraplay, if somebody was like looking at over here, maybe we're looking at a dollhouse, that's we're both focused on that rather than each other.
Yeah.
Right.
Right.
So not that there wouldn't be moments where you're focused on each other, but in Theraplay, all of those toys and things we see as a distraction from Theraplay. If you're doing Theraplay, not
Right.
obviously they're wonderful tools for other forms of play therapy. So in our Theraplay room, we want it as bare as possible. The kind of props that we use are props that will enhance the interaction between us and the child directly. So we might have cotton balls where, hey, I'm giving you a gentle touch with a cotton ball on your hand. Or we're blowing a cotton ball back and forth. You put your hands out like this, I'm going to blow it back and forth. So you see, it's all about that interaction between the two of us. And it's a shared affective experience that's different than a shared experience of using traditional play therapy props together.
Sure. Yeah. And I'm glad that you explained that, just so people could kind of get a glimpse of understanding what the play looks like.
Yes, I always say it's physically
process.
active. We're talking up and down, back and forth, hitting a balloon back and forth, or, jumping as far as you can across the therapy room. So physically active. I have to say physically active because people think, well, of course we play. It's called play therapy. And I'm talking like gross motor.
A certain a certain look. Right.
Yeah. So and the play is with each other. One of my mentors in Theraplay, Chuck West, said the Theraplay therapist has to be the best toy in the room. That's your job.
Yeah.
You are creating that interaction. And the other thing about it that's also very different is we're all about the here and now experience. Right here, right now. What would be happening between you and I, Robert?
Yes.
That's what it's about. In that way, I feel like Theraplay is like a giant mindfulness experience.
Right.
We are right here in this moment right now. So I'm not suddenly linking something that happened with, this might relate to, when you found out your parents were getting a divorce, or when I work a lot with complex and developmental trauma. So, this might relate to when you had to move foster homes or something like that. Our idea is this here and now moment is changing the internal working model. That's how we're changing that early internal working model that Bowlby talked about. Like how I feel about myself, how I feel about the world, what I can expect in interpersonal experiences, rather than talk about what's gone wrong in them. And there's a place for that. I'm trying to amplify what can go right.
Yeah, sure.
What it can feel like to be delighted in. Mm-hmm. Can you see in my eyes that there's nowhere else I'd rather be than playing with you right now?
Yeah.
That here and now experience is how we're trying to work on trauma and how we're trying to work on attachment issues and all of those things. It's a right brain, nonverbal experience.
Sure.
And so that's why it can help with trauma, because it's a wordless experience, as trauma often is. We know that trauma is often, in sensory pieces when someone reports it. Sure. It's also very sensory based.
Yeah.
So we have touch, and we have, we feed children things. So there's a lot of sensory pieces to Theraplay that are also, I think, somewhat unique to the model.
Yeah, a lot of like specific uniqueness. And I think kind of leads me into my second question for you, which is, would there be ideal populations? Kind of talked about that a little bit. Ideal
Yes.
populations or issues diagnosis that Theraplay would work best for.
Yes. Oh gosh, I have a lot to say about. Um, well, first let me give like a little foundational piece to guide our discussion about that.
Uh-huh.
Um, Theraplay is based on what we call 4 dimensions, and there are 4 dimensions that are in every parent-child relationship, and they are structure, engagement, nurture, and challenge. So we have a little acronym SENSE, even though it's not spelled correctly.
Right.
SENC. So, structure is that piece I talked about where we're in charge. We have a plan for the session. A lot of, all of our activities that we do fall within those 4 dimensions. So we're not just going in there and randomly doing play activities.
Yeah.
We, for a child, for example, who's maybe diagnosed with ADHD and has a lot of hyperactivity issues, that we're going to use structure a lot with that child. We're going to have to use a lot of structure with that child. So structure is where we set the pace of things in the session, all of that. Then we have the engagement dimension, and that's our efforts to kind of pull the child into interacting with us and bring them into this shared affective experience. Then we have nurture, and a lot of those are self-explanatory. Like just the example I was giving earlier, I might tell a child, I've got a little feather and I have a little cotton ball, and I'm gonna see, can you tell if I'm touching you with the feather or the cotton ball? So that would be a little nurture activity.
Uh-huh.
But it also slides in the final dimension, challenge. And that's where we're trying to stretch children sort of to the next developmental level, give them little challenges that they can succeed with and feel competent and capable. So when the child guesses, oh, that was the cotton ball, not the feather, I'm like, yes, exactly. You
Right.
got it. That's exactly right. So, and we give a lot of accolades and enthusiasm. Many of the children that we are working with are not getting lots of accolades and enthusiasm about their behavior in other settings.
Right.
And so we're setting up play activities within these 4 dimensions. Okay, so with ADHD, structure comes into play right away. Like we have a really fun activity called newspaper punch. Like we hold up a piece of newspaper. Robert, I'm starting to feel like I should have my Theraplay bag here so I can have all my little
Right.
items that I use. I didn't think of that. But so a child is supposed to then punch through the newspaper. So it is a challenge activity, but if I had a child that was ADHD, I'm going to add more structure to it. I'm going to say, hey, Robert, wait for the signal. I'm going to say 1, 2, 3, punch. All right. 1, 2, 3, punch. And I'm going through a series of punches. We'll try again. And I might vary my signal. The next time it might be the kid's favorite ice cream or something. But the way I'm working with that child with the ADHD diagnosis is I really want to do something.
Right.
But
Right.
I can't
Right.
until you say the signal.
Right.
And that is helping the brain learn to withhold impulse, for example. So, so now if I had a really depressed child, a withdrawn child, and I wanted to do challenge. I want to kind of get them more activated. I want them to be more present in feeling their body. And I'm gonna maybe try to get them to do newspaper punch. I'm not gonna have all of this like weight and signals, and like I'm happy if the kid like half-heartedly just lifts their arm and punches it, right?
Right.
So I'm gonna handle that same activity like really differently with and with a child that's depressed like that. The dimension I'm gonna focus more on is engagement. You know,
Mhm.
how do I pull this child in out of their shell? How do I get something going between us? Um, and I look for activities that would promote that kind of connection, that kind of engagement. Even our hand clapping games, we sometimes use under engagement. Because for a child like that who's kind of depressed and withdrawn, if I raise my hands like, hey, let's try this,
Mhm.
it's a little hard to resist raising yours as well and meeting mine.
Right.
Right then, I've engaged this kid. I've
Yeah.
pulled him in a little bit. So to answer your question, I think that Theraplay can be used for just about any kind of issue or diagnosis, because we alter the way we deliver it
Mhm.
based on the child's needs. So we're going to look at, how heavily we use each of those dimensions based on the child's diagnosis. And even in the MIM, we're evaluating that videotaped interaction between parent and child. We're evaluating that based on those 4 dimensions. Structure. Does the parent provide structure? Does the child accept structure? Engagement. If the child's starting to look bored, did the parent notice, and were they able to figure out, maybe something novel to pull the child in? Nurture. Is there very much touch, closeness? How far apart do they sit from each other? That kind of thing. Challenge. Does the parent offer something developmentally appropriate, or are they trying to teach a 4-year-old multiplication or
Right.
division or something like that, right? And so we're always also looking at, and this is what makes actually conducting these sessions and planning these sessions kind of tricky. I'm looking at the needs of the parent and the child.
Mhm.
So
Sure.
maybe the child is like great with structure. Like I say, this is how it's going to be, and they're very willing to do it that way. But I have a parent that can't set any structure for the life of them.
Yeah.
And when there's a vacuum in structure, the children will take over the structure, like somebody has to. So even when I'm choosing my activities, I'm looking at how do I benefit the dyad. And so I'm looking at the parent's needs in the 4 dimensions, and I'm looking at the child's needs in the 4 dimensions, and looking how can I use these activities. The activities are just my vehicle.
Right.
They're not the thing. Like anybody can find a list of Theraplay activities and go play them with a kid in therapy. Like that is not it at all. The activities are like notes of the music, and I want to put them together in very nuanced and specific ways, so this parent and child can make music, can make a symphony together.
That's a great illustration. Yeah. And I'm glad you added that. So if somebody, is watching this and really interested in kind of what they're hearing, and they want to dive further into this, because there's a lot to learn,
There's a lot to learn.
Theraplay, um, what would be some good resources, books, trainings, etc., that somebody could access? And I'll make sure that they're up here on the video too, the links.
Yes. Well, training in the United States all goes through the Theraplay Institute. So www.theraplay.org. And even in other countries that have a Theraplay association, the United States Theraplay Institute based in Chicago is also going to have their other trainings. This is what's going on in Indonesia. This is what's going on in, the UK. So the main place to look for training, well, the place, is www.theraplay.org. So like when I put a level 1 Theraplay training on my website, it's going to link to registration through the Theraplay Institute. So we're under that broad umbrella of the
Gotcha.
Theraplay Institute. And what I would the Theraplay book 3rd edition by Jernberg and Booth is like currently the big fat Bible of Theraplay,
Yes.
but it's getting old and it needs a revision. But it is still what I would direct people to first. And then level 1 Theraplay is where people, I believe, should start their Theraplay journey. I think maybe like a 1-day workshop or something like that gives you a nice overview. I personally was not willing to try Theraplay until I went to the level 1 workshop, and that's a 4-day workshop. And they're going on constantly all over the world. There's some that are fully in person, and there's some that are called a hybrid, where we do 2 days online and 2 days in person. We don't have anything completely online because there's so much practice involved.
Right.
So, and then, so the level 1 Theraplay, the Theraplay book, and then there's a number of wonderful other books about Theraplay application. There's one by Vivian Norris and Daphne Lender, which is wonderful. There's a new application book that just came out. Their titles are a little similar, so I don't have them all right at the tip of my tongue. I don't want to say it exactly wrong, but always, though, start with the main text and start with level 1 Theraplay is what I would advise people. And I would also say, don't do it without supervision. After you go to level 1, start supervision,
Sure.
and that's what I would recommend: Theraplay supervision.
I think those are great recommendations. And I'll make sure, of course, everything is here on the video so people can access it easily if they want to take a deeper dive here and start their Theraplay journey. What a pleasure. Thank you so much for joining me and giving us information about this. It's really been good. And I just think you gave a lot of good intro info there.
Well, good. Thank you. I aim to explain in ways that are understandable. So.
Yes, so awesome. Thank you, Karen, for joining. Thank everybody for watching. And please just check out these resources. If you have questions, I think you can always contact the Institute, Theraplay Institute, with a question as well.
Yes.
And so thanks for watching. Please come back, check out more videos. Take care.